Good morning. So I would like to speak about 3 policy directions for home care, and these directions are certainly reflected in the Ombudsperson of BC's recent report on seniors' care, which I'll be referring to, but they're certainly also reflected in the experience of frontline workers. And so this morning I'm going to try to emphasize that frontline experience. The first direction is the expansion of home support services, which we've been hearing a fair bit about. And this is certainly a recommendation in the Ombudsperson's report, where she talks about expanding those services in the interest of cost savings, and to do that up to the point of, where it may run into the same cost as having somebody in long-term care. In talking about the expansion of services, she's talking about an increase in overall hours, but also about the types of services delivered. So this is something we hear from our members over the years. Some members who I've spoken with have been in the industry for about 15 years, and they certainly recall a time when they had more time to deliver to perform the types of tasks that they do now, but also when they had time to perform different services. So one member in particular on the island, she was recollecting when at one point in her job, it was fully acceptable. She was able to take a senior who she gave care to out to the beach or to have a coffee. That social time was a given and part of what they did. Now she says they're told that their relationship is a functional one, and the social aspect isn't as important as what it used to be. Their services are increasingly more of a medical nature that they're providing rather than the basic supports. So we've heard about that a fair bit. Things like meal prep, housekeeping, helping with grocery shopping. That's something in the past a senior would have had the independence, like the rest of us, to plan our daily meals, to go out and grocery shop, to get out in the world when they're doing that, to have a home support worker help them prep that, to have that socialization when they're doing that as well. To have the pleasure of cooking the meal in their own home and then being able to eat that, and that's no longer. So I would view that as a deterioration in quality of life if someone didn't let me cook and plan my own meals, and I'm sure that's the case for a lot of seniors. A lot of them resort, when they have the money and the resources to do so, to having to use services like Meals on Wheels or Chef on the Run. Not quite as appetizing, and that's if they have the resources to be able to do it. If they don't, they go without. So, if they don't have the money to do it, or even in being able to cook for themselves, really, really basic things, some are just not able to do it. They're not physically capable. So our workers have spoke about, even though they're clearly instructed to not provide these types of services, they're no longer sanctioned. They may be in there giving care and it's somewhat medical related, but they make a point of frying up an egg every time they're in, Mrs. Jones' home, because they're pretty certain that that's the only nutrition she's getting for the day. They're pretty confident. They know her patterns. Or one of our members was telling me she, towards the end of the month in particular, she does a big batch of food, and she takes that to her client's home. So on Sunday night, she'll whip up a lot of food, and through the week, she'll take that to clients' homes, under the guise of, I just made too much and had extra. But she knows it's getting close to the end of the month, and her clients are running out of money, and this is the way they're going to get food. So expanding services can certainly decrease demand on more costly services to government and on the cost to individuals. We know that somebody's going to bear the cost of it somewhere along the line, and it shouldn't be seniors, especially low-income ones. Expanding the services could clearly help improve the quality of life that seniors are experiencing day to day. The second policy direction is continuity of care, and Isabel certainly spoke to that today. So, like the clients, our home support workers want a regular relationship. They want to know who they're seeing on a day-to-day basis. They get sent in sometimes to a stranger's home, and the stranger's very frustrated because they're not getting the regular worker. And the home support worker is frustrated too because she doesn't know the regular care patterns. And that's a potential or a situation that can potentially become volatile. As Isabel was speaking, you know, these are very personalized tasks that the home support workers are performing. Sometimes it's bathing, sometimes it's toileting. You're in somebody's personal space. And if you don't know, you know, how they like to be approached, that's a situation that's potentially volatile and really invasive for the home support client who's receiving it. The fact that home support workers have regular relationships with their clients also enables them to be good eyes and ears on the ground for the other medical practitioners. So if they see a change in their home support clients, they alert somebody to it. If they don't know the clients, if they're often being sent in circumstances where they're not aware of what the client usually, or how the client usually appears, you know, like Mr. Smith isn't usually all listless, who are they going to report it to? They don't know that there's been a change. So there's that problem in not having continuity of care as well. So improving the continuity, it leaves the client happy or happier. It certainly leaves the home support worker happier, and it has potential to make a more regular and more predictable schedule for the home support worker. So Isabel also spoke about, and I'm sure Anita's going to as well, some of the problems in not having a regular schedule or having to work more hours, having to be available for more hours than what you're actually going to work. So that's a working condition that, if improved, could improve the recruitment and retention situation for home support workers. And it's a win-win, just ensuring the continuity. And that's certainly another recommendation that the ombudsperson made in her report. She cited several health authorities that currently haven't made a point of integrating continuity of care into their policies or their service agreements or their performance measures. So she recommends that they do that. So the final policy direction is on establishing clear standards of care, and along with that, ensuring that home support clients, their families, and the public are aware of them. Again, the ombudsperson makes this recommendation in her report that clear, specific, and enforceable quality of care standards be established for home support workers. She refers to that meaning the type and level of care to be provided, the complaints processes and procedures about services received, that needs to be clarified, and the minimum qualifications and training for staff. She also recommends that there be some consistency in how time allotments are established for services. So as I mentioned in the past, home support workers were given more time to perform certain services. That's decreased over time. But even currently, that varies from health authority to health authority. So if you're a senior living in Burnaby under the Fraser Health Authority and you need assistance eating your meal, you need to eat within 15 to 30 minutes. If you're in Vancouver, you have the luxury of 30 minutes. You get to take a bit more time with it because you're under the Vancouver Coastal Health Authority. So resolving the inconsistency in the time allotments for services. Training, the ombudsperson recommends that there be standardized training for everybody delivering home support. HEU certainly supports that, whether you're delivering it through private or public sector. Home support workers are increasingly expected to learn how to deliver medical services, and often that happens through a transfer of function from a nurse. I mean, it also happens in their training and their schooling, but this is another means on the job. I have heard home support workers talk about that transfer of function sometimes happening by telephone. It's not the nurse's fault. They're just as strapped as the home support workers. The system's stretched all around, but it's not a preferable way for the home support workers to learn. We do this because we're tight on resources. That shouldn't be happening. And ultimately making sure that there's enough time for the workers to be able to deliver the service and meet the standards. That's important. So in setting the standards, the clients know exactly what they're entitled to. The workers get the training, adequate training and time. Workers and clients have adequate time together to meet the client's needs. So these measures, in addition to ensuring continuity of care and the expansion of home support services in types of services and overall hours, would improve quality of life for the seniors and other home support clients, but also permit seniors and other home support clients to continue living in their homes. It keeps them out of long-term care, out of assisted living, and out of hospitals, the most costly part of the healthcare system to seniors, and all institutions that are not always, but often less desirable to seniors, and they're certainly more costly. So that's all I wanted to share with you today.